Breakfast with Bob continues now with a very special feature on something brand new, or relatively new. We'll find out how new, to treat certain drug addictions that's just been approved by the FDA. And with us this morning is a specialist in the field, Dr. Wamv Am. I hope I pronounced that right, a psychiatrist who currently is the medical director of the White Deer Run Drug and Alcohol Treatment Facility in Allenwood, Pennsylvania. And Doctor, this sounds like a sort of different approach to treating relapses of drug addiction. Can you tell us about it?
Absolutely, Bob. You're right about that. It is a very novel treatment approach. The FDA approved the medication known as Vivitrol in October of this year to be utilized to treat opiate dependence, specifically to prevent the relapse or reduce the cravings and urges to relapse to opiate use. The medication is an injectable medication that you get once per month. It's actually been utilized to treat alcohol dependence since 2006, so it's not a new medication. This is actually a new use, Bob, and we're proud to bring it to our clients here at CRC Corporation.
Now, how does it actually work, and what would this indicate? Some sort of connection between alcohol addiction and other forms of addiction like heroin and so forth?
Yep, the medication is proposed to work through the reward center in the brain to help reduce the cravings and urges and euphoric recall to some degree that addicts and alcoholics experience when they use. So essentially, it reduces or eliminates that sense of desire to use the medication and thus, or to use the drugs, and thus the medication helps prevent relapse and reduce your urges.
Does this? How does this differ from the? And can you tell us a little bit about the traditional forms of medication to get you off various addictive drugs?
I'm sorry, Bob.
I'm just wondering how it differs from traditional medications that are used.
Oh, sure. Yep. Well, for opioid dependence, we've had a variety of medications that are available for medication-assisted treatment, such as methadone, Suboxone, and those treatments are still available for addicted people. They're once-a-day treatments. They involve the use of a narcotic medication to help reduce the risk of using drugs intravenously, diseases, etc. This new approach with Vivitrol is actually an injectable medication that you get once a month, and it's not a narcotic, so it's not addictive, and it's a medication-assisted treatment that you get once a month rather than every day. So those are some of the advantages to it, and we believe that it will help reduce relapse and will help people in the crucial period prior to relapse, which are usually the first few months after a person gets treatment.
And how many Americans are dependent on or abusing opioid drugs?
The most recent data I have would be from SAMHSA's National Survey on Drug Use in 2008, and there are nearly 16 million Americans ages 12 years old and older who are addicted to prescription drugs or heroin, which is a huge number of people. And we're not just talking about heroin. We're talking about people who may have legitimate medical problems, who get prescribed a medication for pain and then become dependent on it and eventually develop an addiction to it that requires treatment. If you or a loved one do fall into that category, we have a website you can check called seekhelpnow.com, or a phone number that can be called 866-575-8186 so that you can seek treatment for drug dependence.
Is this usually, I guess, is first administered, since it's injectable, in a drug rehab center, but is it something that people then can take once they leave the center?
Yes, sir. Usually the medication is initiated in a residential treatment center, what people would call a rehab or drug and alcohol rehabilitation center, and then the medication would then be prescribed and injected, usually in a family doctor's office or clinic, to continue that on a monthly basis. after a person completes inpatient treatment.
You've dealt with a lot of people. It's your specialty. Do you have any recommendations on how to avoid becoming addicted in the first place?
That's a difficult one, Bob. Basically, I believe that obviously education, having an understanding of what the consequences are if you do become addicted, finding other ways of enjoyment in life other than seeking those types of behaviors, avoiding people who do use drugs and alcohol. I think it starts very early in educating our children and our teenagers, knowing what they're doing, where they are, who they're associating with, what their interests are, and being a part of their lives. And obviously into adulthood, recognizing the risks and the damage that these drugs can do if you become hooked on them. So.
Yeah, interestingly enough, this is Drug Facts Awareness Week, and I suppose probably you knew that, but we just had an interview earlier this morning with a doctor from the Department of Health concerning this, and it really is a problem. I'm also wondering if somebody needs pain medication and the medication is somewhat addictive, and they know to have problems with other addictions, if it's not possible to give that in conjunction with Vivitrol?
One of the things that becomes very difficult is there are people who truly experience pain, truly need narcotic medication. And it usually does not take a very long period of exposure to start to develop a dependence on the narcotic medications. So I think that it's obviously paramount or of paramount importance that the treating physician is aware of this risk and potential to his patient. I believe, however, that consumers are very educated now, and I think consumers and patients need to be aware that they have this risk and that they can get addicted or hooked on medications. There are a lot of really good non-addictive treatments for pain that can be utilized, and I think that it's very important that people look to utilize those to prevent this problem.
Can you give us the website one more time?
The website is seekhelpnow.com, and the phone number is 866-575-8186. We at CRC Health Group have been the nation's largest provider of drug and alcohol treatment services, and many of our facilities throughout the country offer Vivitrol as the treatment option for opiate-dependent patients, so as well as alcohol-dependent patients. It's a very good opportunity if people need help.
Great. Well, Dr. Jamick, thank you very much for sharing your knowledge with us this morning. And
my pleasure, Bob.
Have a great day.
You as well.